Hello there. I'd like to thank Jill McVicker, Director of Operations in NHS Highland, for kindly inviting me to speak at the Belford International Rural Medical Conference. I'm sorry that I can't be with you today, but I'm delighted to have an opportunity to play a small part in this event to celebrate the evolution of healthcare in this part of Scotland. I am, of course, referring to Belford Hospital reaching a remarkable 150 years of health service delivery in Fort William and across the surrounding communities. This is an historic and truly significant milestone. I'd like to congratulate and thank everyone who has been involved with Belford Hospital over the years for their valuable contributions. Reflecting on the legacy of Belford Hospital and health and social care across Scotland, we mustn't forget that the grassroots of our modern day NHS originate in the Highlands and Islands. When our NHS was born in 1948, 50% of Scotland's mainland was already covered by the Highland and Islands Medical Service. This state-funded system had been in place for over 30 years, offering largely free emergency services. Our NHS has evolved dramatically over the past decades. In 2014, the advent of joint working arrangements between NHS boards and local authorities brought us into the modern era, focusing on closer integration between health and social care services, plus a stronger patient-centred ethos. We're making positive strides in so many areas. For instance, it's hugely encouraging that more people survive cancer than ever before, and the Scottish Government continues to invest substantially to improve cancer treatment. For the second consecutive year, we have doubled our investment in the New Medicine Fund, with £90 million being available in 2015-16. We must also continue to adapt to technological and scientific advances, socio-economic pressures and changing patient requirements, including an ageing population. And we must continue our focus on prevention by encouraging healthier lifestyles. Before talking again about Belford Hospital and some of the challenges and successes surrounding rural and remote service delivery, I'd like to highlight the Scottish Government's priorities and vision for the future. This summer I launched a national conversation about the future of health and social care over the next 10 to 15 years. I want to find out what really matters to people when they think about the support they need to live healthier lives, what matters to patients, those receiving care or support and their families, and what matters to the dedicated staff who support us when we're in need. Looking after people in a safe, caring and respectful way will remain the core purpose of health and social care services in Scotland, building on the 2020 vision, which gives patients a stronger voice. However, the Scottish population is living longer with more complex and often multiple long-term health conditions, and our lifestyles have changed. Smoking, alcohol use, inactivity and obesity mean that conditions such as cardiovascular disease, type 2 diabetes and some cancers are more common. As demand for treatment increases and expectations rise, those providing support and services are under pressure. We know there is more to be done. With the national conversation, my aim is to seek broad agreement on how to make more progress in improving the health of our population and on how our NHS and social care systems should evolve over the next 10 to 15 years to enable people to live well and as independently as possible. So I aim to reach broad agreement on key principles for the shape of the future by mid-November. We'll then have further engagement on the details of future change by the spring of next year and beyond then to implementation. I recognise that changing systems isn't easy, and so I invite you to use this opportunity to feed in your views and help shape services for the 21st century. Whilst there are benefits and opportunities for people living and working in remote and rural areas, I understand that there are also real challenges for delivering health and social care across rural areas. Traditional models of healthcare provision in remote and rural areas are not sustainable, and that's why my predecessor Alec Neil asked NHS Highland to develop proposals to consider new models of healthcare delivery which will support patients and staff in line with the healthcare quality strategy and the 2020 vision. The Scottish Government agreed to provide £1.5 million between 13-14 and 2016-17 to fund the testing of new approaches to working in 4 areas across NHS Highland, namely in Campbelltown, West Lochaber, the Isle of Islay and Mid-Argyll. It is called the Being Here programme, and I know that you'll be hearing much more about it during the conference. The programme has generated some great work in NHS Highland. To tackle the barriers to recruitment and retention of staff, including GPs, Being Here has helped deliver an ambitious and creative recruitment exercise aimed at attracting health professionals to come and live and work in remote and rural areas. With a new microsite and targeted advertising campaign, a number of appointments have been made. New technologies can create real opportunities in both treatments and access to services, and I commend the innovative approach of installing telehealth facilities in the Small Isles medical practice on Egg, with links to other islands being developed too. This will grant patients improved access to virtual face-to-face consultations remotely with their GPs. There's a need for more multi-professional working in remote and rural areas to help address recruitment challenges, so I'm encouraged that there are now visiting services from Skye to the remote Small Isles. That includes Canna, Rum, Egg and Muck. One of the work streams in our Sustainability and 7-Day Services programme supports the sustainability of Scotland's rural general hospitals. As a result of this work, a successful network for general surgery has been established between the Belford Hospital and NHS Lothian, whereby the latter provides professional and CPD support. These are just some examples of the flexible and innovative approaches that are helping to improve healthcare delivery in some of Scotland's remote communities. I commend the hard work of everyone involved who are helping to drive forward these crucial improvements. This is vital work. And this is why the Programme for Government 2015-16, which sets out the Government's goals for the future, makes specific reference to supporting rural hospitals. It also recognises some excellent progress with new integrated working. For instance, Highlands Health and Social Care Partnership that has introduced its innovative commissioning approach to improve the capacity and quality of care at home. In conclusion, I'm proud of our diverse NHS in Scotland and of everyone who plays such an important part. The needs of Scotland's population are changing and our healthcare service must evolve. I'm committed to ensuring that we give everyone an opportunity to help shape future changes through the national conversation, and I'm convinced that the NHS has the ability to adapt successfully. We need to look no further than the excellent and innovative work being delivered across NHS Highland. Finally, on behalf of the Scottish Government, I offer my congratulations once again to Belford Hospital on its 150 years of health service delivery. I wish you all a stimulating, vibrant and fun event in Fort William. Thank you.